We've just looked at some of the benefits of PBC, and it's clear that it gives practices and primary care professionals the freedom to develop innovative, high-quality services for their patients. But it doesn't come without its challenges. When we asked you what you thought the challenges were, this is what you had to say.
Well, the main one is handling the information revolution, and there's quite a lot there to take on board and then to absorb the change in practice alongside everything else that we have to do.
On a personal front for Unicom, that involves increasing the evidence base for student health needs. They are very different from the local population, and there's been little research and there's little detail about what those health needs are. And certainly we've been working with the PBC team through our FIRs, going to be looking at that in the next couple of years.
It's a new concept, the practice-based commissioning as such there, and to get it organized and to take it forward is a challenge in itself. Since it's being a new concept, to get the integration of or cohesion of a group together, as they are small practices, as you can see from a cluster, and they are like-minded, and our needs for our practice or the cluster are very different to the other clusters as well there. And to bring them together, that was one of the challenges there for us to do.
I think the greatest challenge of PBC is keeping everybody on board and taking into account the views of all the stakeholders. Obviously, for PBC to succeed, we need buy-in from all GPs, and with all the other pressures on general practice at the moment, both from the Department of Health, the PCT, from patients, it's difficult for clinicians to find the time to engage in yet more activity.
One of the problems is developing clinical engagement and getting more of the workforce excited and enthused by practice-based commissioning. This takes quite a lot of time, and we need resource allocation diverted in some ways from secondary care to primary care to allow some of the projects to work, and also to fund the time and the energy of the clinical staff being involved, because obviously they're taken away from patient care at that time.
That what we have to do is to make sure that we focus on providing the very best process of care for patients, and that involves and must involve a very close understanding and partnership between practice-based commissioning and primary care colleagues and hospital-based colleagues. And if we do that, then the experience of patients will be greatly enhanced.
One of the challenges of my role is the depth and breadth of practice-based commissioning, and actually ensuring it's going in the right direction. It's also about managing local expectation and national expectation. I would say that's a large challenge.
Well, I think as practice-based commissioning is developing and clusters are becoming more aware of the opportunities that practice-based commissioning enables, then I think clusters are becoming more demanding of their PBC managers in terms of the information that they're asking for.
I think the biggest challenge working with the clusters in Nottingham is that they're not arranged geographically to fit in with the different districts of the city. So when it comes to linking up cluster work with what's happening in different neighbourhoods, that can sometimes be quite tricky.
Well, I'm the head of information, and I'm the head of a small team of analysts, which covers all of public health commissioning and any other PCT information, quite a lot of provider information. With world-class commissioning and some of the other PCT priorities, there's a huge demand for our service at the moment, and it's quite a small service.
We're working hard to ensure that we provide adequate financial information that's accurate, it's timely and it's relevant. The information that's contained within the packs can be used as a basis of discussion at cluster meetings to analyse areas where improvements can be made, but also to highlight areas of best practice which can be shared amongst peers.
I think inevitably general practice has been incredibly busy. There are new initiatives for primary care. There is quite a significant transition of care from secondary to primary care. So for example, if we look at areas like diabetes, so I can imagine general practice has become a far more complex place. However, I think the key is getting the right support to general practice to make sure that spending the resources we have are responsive to the needs that general practitioners see every day.